Choll from San Diego, California. One of my favorite cases. We have a otherwise very healthy, active, and very studly and muscular 43-year-old mortgage lender from Rancho Santa Fe, of course, where my brother lives, because us poor spine surgeons, we have to live in Scripps Ranch. Anyway, look at this spondy right there. All over the place, but the most telling thing is that when he stands up, the spondy looks like this, and when he lays down on the MRI, the spondy completely goes away. Isn't that crazy? So you can't tell how much stenosis and lateral recess stenosis he has, but you can see he's got facet arthropathy with facet cysts kind of wanting to come out. He's in pain. He can't work or participate in any sports activity, so he's kind of boring right now. And he's tried everything, so we've decided to do surgery. This is a patient that has instability. So when you have instability, you want to stabilize, and the best way to do that is to do a reconstruction infusion. But if you're going to do that, do it using the most minimal invasive techniques as possible, and all the principles of minimal invasive technique, along with delicate Asian fingers, meticulous attention to detail. So we're all hoping for a great result. Alrighty, we're getting started. I have the navigation tracking pin. That is that little whale that you have in the back of your car or the golf cart. That's the satellite. That's your navigation screen that you see in the car. And this is your car. And your spondy is so much better that I can't even really tell which level we're supposed to work at. But that's it right there. And that's how it picked the perfect entry point. I cheat. Because you know my mom always said, if you don't cheat every once in a while, you ain't trying hard enough. Alrighty, now I'm painting dentist. I see a big cavity right here that looks like it hurts. Because a lot of the things that we do in spine surgery, we take from the dental field. All our titanium implants that grow into bone, that's from dental implants that they screw into your jawbone and realize titanium works the best. And that's why we use titanium. So I'm like a glorified dentist right now and loving it. Just working, not a care in the world. It's going really well. Now I'm doing the discectomy. You got a big, juicy disc, but it has no substance to it at all. It's sort of like that Wendy's commercial. Where's the beef? It's like, it's not inside this space. This cage is still the sexiest cage alive. I don't care what anybody says. There's a bunch of contenders, though, because once they saw these cages, they're like, I need me a sexy cage. So there's like about 3 wannabe sexy cages coming out there, but this is still the sexiest because if you look at that x-ray shot, look at this interbody expansion. Alright, the other part of how do I do big surgery through small incisions? You have to have things that go like this, like magic. How does that bend? I'm so confused. So it goes down like this, touchy touchy, back it up, kick it over, slide in the tip, just the tip, and then down and across. I know, whose idea was this?
Dr. Kim, how do you do this big surgery through such a small incision?
I'm glad you asked. First of all, I use computer navigation. And even before I make my incision, I can tell where the perfect entry point is. So the incision is only as big as it needs to be. And then if you look, I'm putting in pedicle screws. That bone right there, you can see the tunnel, the left column. That's the pedicle. And imagine putting in this screw without navigation. Can you imagine how hard that would be? It's hard. But with navigation, you can put it in perfectly.
Exactly.
And that's one way we do big surgery through small incisions.